The subject of today's show is going to be the various cannabis-related bills facing the Oregon legislature this session. And so, with me in the studio today to discuss are Sam Chapman, legislative director of the new... Sam Chapman, legislative director of the New Revenue Coalition and the principal at New Economy Consulting, and Casey Houlihan, head of the Pacific Northwest Development for BDS Analytics, which is a leading market research and data analytics firm, which focuses on the cannabis industry. And he is also the executive director of the Oregon Retailers of Cannabis Association, which, for the purposes of this conversation, we're going to refer to as ORCA. Which is a statewide trade association which represents over 350 retail cannabis businesses. Sam and Casey, welcome to the program.
Thanks so much for having us, Lee.
Indeed. So let's get into some of these bills, and we're going to try to do this as quickly as possible, but at the same time, like, some of these are really going to need some explanation. So let's start with a bill called SB 639. Sam, what can you tell us about SB 639?
So Senate Bill 639 is a bill that Senator Lou Frederick, I believe this is his district here in North Portland.
Yes, it is. Yep. And he's been a guest on the show.
Yep.
Episode 12.
So I've been working with Senator Lou Frederick and Senator Floyd Przansky on introducing this bill, which seeks to license and regulate cannabis consumption venues and events. There's also a couple of additional things that we'll get into in a second here that it does. But overall, as most people know, we have legalized cannabis in the state of Oregon.
Indeed, we do.
What a lot of people may not know is that it's it's a pretty privileged form of legalization. So, well,
why is that?
What do I mean by that? If you do not own your own home, chances are you are living in some type of facility, if you are lucky enough to live in a facility, that has something in your lease requirement that says that you are not allowed to consume cannabis in your premise at all, subject to being kicked out. We are now also seeing those leases say not only can you not consume cannabis in your apartment or whatever it is, you cannot physically possess cannabis. So who does this disproportionately affect? Renters, medical cannabis patients, people of lower economic status living in federal housing, and people of color. I don't think it's a stretch to say that if you are willing to take the facts on its face that people of color are getting cited and, arrested for, simple drug possession, that they're probably also getting cited at a higher rate for cannabis consumption in public. The problem with that is the way that law enforcement reports those numbers, they're not drug specific. So we're never going to be able to know
to split off cannabis use.
We're never going to be able to find out, unfortunately, the disparity of who is getting cited in public, right? And that's something that we really would love to find out, and we're going to be working on seeing if we can change some laws to get that data. But I digress. The bill. What does the bill do? Creates a new license type for consumption venues, right? And one instance is that it can be a bring your own model. Right, which would be great for some of the existing facilities out there, some of which are here in the city of Portland. And it also would allow a co-location of consumption at retail stores. And so I think that's huge, right? That's something that,
that's effectively a cannabis cafe.
That's right. Yeah. Exactly. Lounge,
Amsterdam
consumption venue.
style.
Yeah, exactly. And go ahead.
And tasting room.
Yeah, and tasting room. Exactly.
Important.
Exactly.
Thank you.
Yep. And so it's pretty straightforward. The one unfortunate controversial, I say, quote, controversial aspect of it is that we need a waiver from the Indoor Clean Air Act to really have meaningful reform within the cannabis consumption space, right? I don't think it doesn't make any sense to force people to smoke cannabis outside. We live in Oregon, for crying out loud, right? And not to mention that there are already affordances for other smoked products, right? I hesitate to really try and compare cannabis to tobacco very much because, one, it's not comparable.
Not at all.
And two, that's what the opposition does.
But they're both combusted substances.
That's right.
For the stipulated.
That's right. So, if we're going to allow hookah bars to exist and we're going to allow cigarettes to be smoked outside of 10 feet from every public doorway in the state of Oregon, why can't we allow people to consume cannabis in private, outside of public view, in a licensed and regulated place where there are guidelines on how you do it?
Right.
That's the question that we're going to be asking the legislature this session.
Right. Why can't we be treated like everybody else?
That's right.
And one of the things I'd like to add to that, too, just because this is a really important component to it, Oregon's Clean Indoor Air Act is actually very unique in this way. Some states have gone in the same direction as us, but not most. So even California now, you're seeing some jurisdictions come up with allowances for indoor consumption venues. They're not up against the same challenge of having a Clean Indoor Air Act that specifically precludes smoking or combusting of cannabis indoors. We amended ours in 2015 to add cannabis specifically to the list of things that cannot be smoked or combusted indoors in any workplace. So that's a very unique set of circumstances that we're up against. And one of the pieces of information that we get from opposition is that they have a concern that because the Clean Indoor Act was so hard fought in the first place, that there can't be any changes, any amendments, any exemptions to it whatsoever. But this is not something that's 20 years old. This is something that was slipped in relatively recently,
Right.
and it was one of the few pieces of legislation in 15 that did not go through the dedicated committee for cannabis issues. This was kind of backdoored at the time. So this was not something that most cannabis advocates, allies, lobbyists really had an opportunity to provide input on.
Yeah, right, exactly.
So this was something that was done mostly by public health, mostly behind the scenes, and relatively quietly to expand the Clean Indoor Air Act beyond what anybody ever anticipated its scope being.
So what would the benefit? So thank you. Well, I'm curious. I want to kind of move to what the benefits of 639 would be as far as you guys see it.
Sure. Yeah, I mean, the first benefit is literally providing a legal place to consume a legal product because most people don't have that right now. Again, unless you own your home. I'm pretty sure there's the vast majority of Oregonians do not own their home, right? And again, that disproportionately affects a lot of already
Marginalized.
Marginalized demographics. Yeah, exactly. And so, first and foremost, we see this as a social justice issue. We see this as an issue of public accommodation and an issue of really getting rid of, what our good friend Lee Berger calls canna-bigotry, right? I mean, straight up, that's what it is. A lot of people laugh about that, but that's because they probably don't use cannabis or know anyone else that uses cannabis. And so they see that we're being otherized in a lot of ways. And so first and foremost, it's
that and they're privileged.
That's right.
They have
that's
a
right.
completely privileged experience.
That's right.
Of which, like, I can consider myself one of those people. I don't mean to.
Absolutely. Nope. Yep. That's correct.
Yeah.
Secondly, this is an issue of opportunity for the state of Oregon to capture or lose pretty quickly here. There are economic incentives here. I think that
I would imagine huge ones.
I mean, it's hard to quantify, but it's obvious that if we have a glut of cannabis, I'm gonna get off topic for a second and come right back. The first answer is finding places to sell it in other markets to sell it in, export. Thank you for covering. Thank you for covering that in previous episodes. But secondly, people have to have a legal place to consume it. The tourists that are coming here are going to buy more if they have a place where they know they can legally consume it, right?
Yeah.
I mean, I'm constantly hearing, from travel organizations that are getting calls on a weekly basis from flight attendants, taxi drivers, Airbnb people, like, hey, people are asking us where they can consume this product. They're coming to taste the craft cannabis industry of Oregon, but they have no place to consume it, right? And so,
well, one thing that I'd love to add to that as well is just in terms of the economic potential that indoor consumption can offer folks. And again, I hesitate, like Sam mentioned earlier, to make a direct comparison to another intoxicant like alcohol in this case. But one of the things that people are allowed to do at a liquor store now is a vendor is able to come in and set up a table and provide samples and information. And Oregon's cannabis market right now is extremely aggressive. It is a very competitive place, and vendors right now are looking for any advantage that they can get to demonstrate to consumers why their product is superior. And because of a lot of other limitations on advertisement and outreach, cannabis businesses don't have the same platforms that a lot of other traditional businesses or industries have. And this would be one that's a very effective way of getting some of these important pieces of information into the hands of consumers.
Right.
And especially if that's something just like at liquor stores where people are able to sample a small amount of that product before buying a half ounce or an ounce of something. If there was a small, separate, secluded room with appropriate ventilation, the bill would allow retailers to set that up as a tasting room space. And there could be additional rules as part of that for making sure people don't consume too much, or in that setting, making sure people aren't bringing their own cannabis if it's to a store.
Right.
And that can be set up separately than a standalone consumption venue where people can bring in their own cannabis. And the bill would allow for
it's not
both.
a free-for-all. I mean, this is a very thoughtful, sort of, go ahead.
No, that's absolutely right. I think you hit the nail on the head. It was really set up to make sure that we could provide a series of different venues where folks could safely consume indoors and not be left out in the cold. And I don't say that just as a turn of phrase. I mean that anything that does not have an exemption to the Clean Indoor Air Act will literally force people out into the cold to consume.
Right.
And that's not to say that we're not willing to make concessions on some of this, right? I mean, we're asking to be regulated probably twice as much as any other quote unquote intoxicant industry out there.
Final thought, Casey, about this bill, regarding some of the public safety arguments against it.
Well, Sam brought up a lot of really good points, too, and that's something that we've been hearing from a lot of the opponents to this bill on the public health side and the public safety side is some of the specific concerns that they have about people consuming at the social consumption venues and then being let out into the street and how they would have no way of monitoring or overseeing what kind of damage that they could cause to the community or if they're driving.
Monsters.
Precisely. Meanwhile, at the same time, it's not uncommon at last call for people to order a bunch of drinks right after they've been drinking all night, and as soon as they consume it, they're out into the streets, and it's at least an hour before something like that gets fully into their bloodstream. Right. And if we can't
should stipulate isn't great, but go ahead.
Right,
yeah,
but what we need to do is have an honest conversation about how the harms of one of these compares to the harms of another,
right.
so that we can demonstrate that under almost any circumstances, cannabis is the less dangerous, more safe option for these people, and there's no compelling policy reason why we shouldn't be allowed to have people consuming indoors.
Why the double standard?
Precisely.
Great. All right.
So we can handle a lot of the rest of these in a little bit of a lightning round format because some of these are pretty clear cut. And 582 is a really important one. We actually just had a hearing on that last week as well. So what this bill would do is set up a framework within the state that would allow for us to remove all of the statutory barriers that we currently have to exporting this surplus supply of cannabis that we have.
Bill.
That's right. And right now, the way that it's shaping up, it really looks like what they're trying to do is not permit explicitly the governor to proceed with these types of interstate transactions prior to federal legalization, but make sure that there are absolutely no barriers such that as soon as the federal government flips the switch and allows the trade of cannabis between states, that Oregon can be the first one that operates.
In the chamber.
Absolutely. First one out the door, make sure that we've got that, 6.5 year supply right now, I think, is the current backlog of wholesale.
Indeed it is.
Flower. And so that could be very easily and very quickly converted into revenue for our schools and for our law enforcement. It's really just a matter of making sure the legislature has the will to do so.
Right.
And I cannot even begin to describe the number of jobs that would create, particularly in some of the southern Oregon areas of the state that are, the high production counties. Certainly the hardest hit in terms of the loss of local revenue from, say, timber taxes that are no longer coming in and areas that need jobs desperately. And so we could be creating 10, 20, maybe 30,000 jobs with this because the number of producers that are licensed in the state right now, currently sitting at around 1,200 and another 900 or so in the queue, could employ many more people each if they were able to scale up their production to meet a national or international demand.
Yeah, so, and for listeners that may or may not know, we actually did an entire episode on this. It's episode 11 if you go to the podcast. This is the One Fix solution, right? And you can go to onefix.org to find out a lot more than what Casey just laid out about this very, very, very important export bill.
You can, and Adam Smith from the Craft Cannabis Alliance has been really instrumental, and I know that you've had him on before as well, and he's been speaking really wonderfully to this specific issue.
And it's like
it's
getting a lot of movement. It's getting a lot of press, like it seems like there's, so what's the opposition there? Is it Billy Williams? Is it?
So to be honest, most of the opposition that we've heard in the building is coming from folks within government that have concerns about what happens if the state proceeds with these types of interstate transactions before it's federally legal. Like, we've definitely heard a lot of pushback from folks in the governor's office who have a lot of concerns about her signing on to a multi-million-dollar interstate illegal drug deal.
Right. What happens if the state breaks federal law?
Which is a fair question, but at the same time, and this seems like a good time to mention I'm not a lawyer, but I've heard from many lawyers that there is a really sound argument to be made that everything that we are doing as a state to regulate cannabis within the state, from our medical program all the way to recreational adult use 21 and over stores, is all federally illegal. There is no pretense whatsoever
we've been
for any of this to be
federal law
happening.
for a long time.
That's right, 20 plus years.
Colorado's been breaking it longer.
So I don't understand necessarily what makes them think that that's going to be the issue that causes the DOJ to use its extremely limited resources to go after states that on both ends of that transaction are following state law and the will of their people.
Right.
And if anything, that might be the thing that finally forces this change to happen federally, which I think could happen within the next 2 years. And that's one of the reasons why, especially with Oregon's extremely limited legislative calendar, that we do this now.
Right.
We do not want to be stuck in a situation where we have to wait another year and a half or two for a legislative session to roll around so we can make these changes. Because if we're doing that, some other state isn't going to. California's got a full-time legislature, and they've got plenty of production areas. So we want to make sure that Oregon is first in the nation to do this.
Indeed. All right. So again, you can find out more about that at onefix.org. Moving on, let's talk about HB 2655, which is another really, I think, critically important one, frankly. Almost as important as social use.
Well, and I actually think this is a really common overlap between a lot of the stuff that Sam works on, a lot of the stuff that I work on. And I could be wrong, but I think we're actually the only two dedicated cannabis lobbyists in Salem. That is to say, there are other folks that lobby on behalf of cannabis in the industry at large, but they also do contract lobbying for other clients and are mostly known primarily as lobbyists. I believe Sam and I are the only folks that are specifically dedicated to doing cannabis-only lobbying in the building. And so 2655 is a fascinating one on the House side. We work with Representative Gorsuch on, who's a former law enforcement, current professor over at Mount Hood Community College. And so what this would do is make it illegal to require a drug test for cannabis, a urinalysis for cannabis, as a condition of employment, whether that's pre-employment hiring or for potentially losing your job.
Right.
And we don't think anybody should miss out on any economic opportunity because they chose in their off hours to consume cannabis.
To not break the law.
I want to clarify what this bill does not do is allow people to show up impaired to their jobs and prevent their employers from being able to fire
Is
them.
that some of the political pushback and
That's
sort of
most of the
histrionics around it?
That's most of the pushback that we get right
Interesting.
now is from employer groups, specifically in heavy fields, whether it's hazardous materials or heavy machinery,
that's fair.
construction fields.
But
and
I mean, it's BS, but it's like it's
further, we have exemptions in the bill for basically anybody that's showed up to oppose it thus far, so that if you are working on a work site where there is any public safety concern for your employees, if they have any residual amount of cannabis lingering in their system, then you don't have to have this apply to you. But if we're talking about Plaid Pantry, or we're talking about somebody that mops at Fred Meyer's, or any other number of jobs where you're not going to be presenting any public health hazard to yourself or others if you consume cannabis in your off hours, then there's no reason why that should not be allowed. And so this gets to what Sam mentioned earlier about privileged legalization, where, a CEO of a company is almost certainly not going to get drug tested, but, the folks that are, doing the bagging of the groceries or washing dishes or whatnot are. And that's a profoundly unfair system. It's worth mentioning, and I brought this up during the hearing that we had earlier in the week on this bill too, that the folks in the legislature and their staff are not drug tested as well. And thank God
what do
for
you know
that,
about that?
because if they were, boy, that would be a kaleidoscope of results that we would see.
Yeah. Well, the only thing I want to say on this is that this is almost as important for the employers as it is for the employees. I can't think about how many friends, that I've had conversations with about I was going to apply for this job, but there's a drug test and I use
what does this do to the labor market?
And I use
right?
cannabis, right? Yeah. And I and my first question is do you know whether or not they're specifically testing for cannabis? And the answer is always no. I have no idea. I just assume that's what they're testing for.
Right.
Now it's hard to say, and no company is going to say, or most companies are not going to say, take this drug test, but if you come in hot for cannabis, you're fine.
Right.
Like no one's going to say that because that's a liability for them to say that.
That seems like an HR problem.
But I mean, we've heard stories going at 3-4 years ago that the DEA is having problems hiring agents because of their drug test. The FBI,
This was famously a case.
I've read that too.
The cybersecurity division, because they were trying to hire
exactly.
white hat hackers, and one of the requirements for the longest time was you have to have a clean result on a cannabis test for something like 6 months, I think.
James Comey testified in open session once about how they couldn't find good cybersecurity people
and so they dropped that
all smoke
requirement.
weed.
So they dropped that requirement.
Yeah.
So this is how we can force federal change.
The Silicon Forest would not exist in the city of Portland if all of them were drug testing for cannabis, right? So really being able to show employees that you've got this one piece that we can carve out here. I'm actually a proponent of, whatever you do on your own time in your own home is your business.
Indeed.
As long as it doesn't affect anyone else or affect your performance, butt out, right? And incrementalism and politics at the end of the day are going to be, what rings king.
Yeah. That's how it works. But.
And Oregon, additionally, it's worth mentioning, has the highest rate of failures for pre-employment drug testing for cannabis. It's something like 4.6%, which is like a full percentage point higher than the next state down in the line. So we have a huge number of people that are failing these pre-employment drug tests for cannabis relative to any other place in the country. According to the latest Consumer Insights data from BDS Analytics, it's 41% of folks in Oregon now, 21 and over, have consumed within the last 6 months. So a very significant percentage of those could technically be ineligible for a great deal of the jobs within the state. And that's a profoundly unfair system. So we're trying to correct for that here and create something that provides a little bit more fairness, a little bit more of a level playing field for folks.
Super important. All right, thank you for that. All right, so let's talk about, I think, frankly, another critically important one, if not the most critically important one, which is SB 420. Sam?
Go for it, Casey.
Oh,
Thank you, Sam. No, quite all right. So this is something that the Office of Senator Frederick has been working on. We've been trying to do what we can to support their efforts as well. And so this would create a pathway for automatically removing or expunging past criminal cannabis offenses for things that would no longer be illegal under the law today. And the same goes for if you'd had a felony charge at the time that might still be illegal today if it were for a large amount of sales. That'll still be scaled down. That'll still be revised and revisited so that your record will no longer reflect that that was a felony at the time. It would reflect that now it would be the equivalent of a misdemeanor or civil citation. Or
and we had Senator Frederick on the show, and listeners can go back on the podcast episode 12 to find out and hear from him. Hear from him personally on this. But can we talk about briefly what these past criminal offenses on people's records, the damage that does? Again, going back to like the labor market and what we were just talking about.
Definitely, and it's a lot deeper than that too. But obviously,
voting rights. Voting rights. No, that doesn't apply here. Sorry,
it actually does, and I'll tell you why. Because in Oregon, some of these cases that are 10, 20, 30 years old are still on people's records, and several of those people have subsequently moved to states where cannabis is still illegal, or where felony voting rights are not as strong as they are here in Oregon. Whereas in Oregon, as long as you are not currently incarcerated, you can vote. Several other states have it if you have anything on your record, substantive or any
totally right about that.
F mark at all. Then yeah, that's right. So if you've moved to Florida, for instance. Well, now I suppose Florida's fine because they passed that, but maybe just rewind that. So if you've moved somewhere else, then that's going to be a factor in how you're able to participate in your local government. We want to make sure that nobody is suffering or, denied their constitutional rights to participate in government just because of, them being previously a victim of the war on drugs, which we know now was wrong in the first place. And obviously, this does have a disproportionate impact on communities of color and the folks that were taking the brunt of the damage from the war on drugs for years and years. These offenses disproportionately fall on communities of color. And so this is a really easy way that we can try to provide some element of justice to the folks that were denied that. Obviously, in addition to the voting rights, many employers will require a background check, and if they do have a felony drug charge in their past, that could preclude them from getting that job. And it's not just jobs either, but certainly housing this applies for as well.
Housing is the other critical, huge component of this.
And it doesn't end there either, but this impacts people's lives in many varieties of ways. I know you just mentioned an example previously, but a friend of Sam and I's down in Salem, his father recently tried to apply to be a Little League coach for his grandson's game, and was denied because of a 20-year-old cannabis possession charge. So this is having this massive impact in people's lives economically, socially, and it's just depriving people of dignity in so many ways. So we want to just set up a very easy pathway to have that apply automatically. We do have an existing pathway in Oregon for expunging these past cannabis offenses, but it's costly. You need to hire a lawyer. You need to petition the court. Yeah. And so therefore it does not get into the hands of
white people.
Precisely. Right. And it doesn't get into the hands of folks that need it the most. So we can do this automatically. Yeah. We just need to change the state statutes.
The people who don't trust the system for good reason
don't even have access to it.
Yeah. Well, and considering the system is the one that provided the pathway for expunctions that requires you to hire a lawyer, brought to you by lawyers, that's obviously a concern. So we want to make sure that that's more accessible, more revolutionary, and can actually achieve some element of justice that we can measure.
Okay, great. All right, so let's move on to SB 2687, which was something I knew somewhat about these, all the ones we've talked about so far. I did not know about this one, which is very, I don't know. Which was I found this one really just kind of dark,
I was actually really surprised at the time because this bill got a hearing a couple of weeks ago as well, and Orca was the only cannabis industry group that had bothered to turn up about this. But right now there are still people that are getting denied organ transplants because they have a residual amount of cannabis in their system, even if that's a part of their normal routine for self-care or under the guise of medical care, even with an appropriate doctor's recommendation, does not matter. And so we already have existing law in Oregon that says that you cannot deny somebody an organ transplant simply on the basis of them having an Oregon medical marijuana card. And what people are being denied for right now is not having an Oregon medical marijuana card, but being medical marijuana consumers.
So
mind-boggling. And the face you just made is exactly the face that the folks on the committee made when it was this woman who showed up whose husband was being denied a kidney.
Once more, being denied an organ transplant because they had cannabis in their system.
And this is a particularly egregious case where this woman showed up to talk about too, and I was really glad that she did because her husband in his situation was having a lot of back pain issues for the years leading up to him needing a transplant, and the back pain turned out to be because of his kidney problem. It was pushing up into his spine and it was causing a lot of pain. Right. So that entire period of time that he was waiting, the doctors were giving him opioids. And he didn't want to take them because he's understanding of the long-term risks, long-term potential damages of that as well. So during the time that he was waiting, he was using cannabis to treat his lower back pain, which any medical professional that's up on the latest science will tell you that that is a preferable option.
Yeah.
And yet he's still denied life-saving medical care as a result.
What happened to that guy?
I believe he's still waiting.
I want to ask you guys. We ask our guests one final question. We're getting short on time, so let's keep it sort of brief. But how do you guys define quality cannabis? As people who,
Speaking for myself,
yeah,
the nose knows.
the nose.
I go by
knows.
smell 100% of the time.
Yeah.
I mean, obviously there's some visual inspection, but I like something that really stands out. I want something that's got a very dynamic smell to it. It's got a level of complexity to it. And obviously if it's very potent, that helps.
Yeah, it's funny. When I was reading this question and thinking about what my response would be, it was not a typical response. I mean, I think you asked that question to the general public. A lot of it's like, what's the THC content, right? And that type of thing. And I think that's one indication that some people like to look at, and I think it's going to fall by the wayside as the major indication after people and science and education continues to grow outside of the internal spectrum where it has existed for so long. But I'm with Casey. I mean, bag appeal. I'm a bag appeal man, right?
Exactly.
It's the same way I was in college, the same way I am now. How does it look? How does it smell? How does it taste? Straight out of a joint, right? I want the terps. And it's hard to find that stuff. Even in a commercial market, people are really still trying to figure out that bag appeal is king. Right.
Well, and Sam really kind of hit the nail on the head too in regards to potency. I made a comment about how obviously more potent pot is good, but the numbers that are associated with the testing have such little correlation
Right.
to how
Potency
quality
doesn't
or-
necessarily mean a high testing number.
That's right. I can't tell you how many times I've encountered a strain that only tests at 15, 16%, but maybe because of the terpene
But it's got
profile,
4.5.
and it'll put me down like a trank dart.
Yeah.
So it's really a subjective metric, and you really got to use your eyes, ears, nose, taste buds, everything.
Indeed. All right. Let's leave it there. Sam Chapman of the New Revenue Coalition and Casey Houlihan of the Oregon Retailers of Cannabis Association. Thank you guys for coming on the show. This was really great. You guys are awesome. You were listening to This is Cannabis on XRAY FM. We will be right back.